not covered by the insurance that dealings with you.
You would know that on the phone, and then you would have the option to self-pay. So they would check your insurance and see if you're in network or out of network. So it'd be your choice. Then they would take a credit card over the phone.
Since you began, which is several months ago, how would you characterize the major obstacles you've run across in making the program known to people and actually working?
I don't know that there's been a lot of obstacles in making the program known to the general public. It's interesting. People are, like I said, people are very digital in today's world, and so when they're searching urgent cares, they're going to get Dispatch Health pops up. We have a big banner for Dispatch Health on our Lee Health website if they're looking specifically at Lee Health. I think our biggest barrier has been for the patients that are actually in the hospital to coordinate the program so that we can discharge them, as I was discussing, we can discharge them to Dispatch Health for that intermediate bridge visit. And one of the reasons that we're having that barrier is technology based, because we're still working to connect our programs so that we can provide an electronic referral, and it doesn't take our care managers 20 minutes on the phone to have the conversation. So for the general public, there really haven't been any barriers. There's been a tremendous utilization.
How do the discharge planners view you folks? I mean, do you see them resisting using you or referring?
I don't think that they're resisting using. I think their barrier is the technology to make the connection.
Okay.
Yeah, it's not a resistance thing.
Okay.
And in fact, Millennium is now starting to use Dispatch Health as that bridge care from patients that are being discharged from the hospital, in addition to our Lee Physician Group providers. And so it's just the service. Everybody wants to keep their patients healthy, and that's really what it's about. Now, the barrier is that connection, and we're working on getting that connection so they can make an electronic referral.
What's your goal in terms of the year end, in terms of vehicles available and people available to serve the needs of the people?
Well, I think that right now we just recently added the third car. I'm not anticipating that we're going to add a fourth car anytime soon until we get up. We have certain milestones that we need to get to with volumes, and so the third car we brought in a little bit before we actually needed it, because we didn't want to say, hey, we need the car, and then have to wait. You know, there's the global supply chain shortage. It's not as easy to get a car, and they need to have some things done to the car before they can get there. So I predict that we're going to have 3 cars throughout this year, and then we'll be watching the volumes closely. We do have a defined formula for when we need to bring new vehicles in.
So you have a trigger.
We do. Yeah.
So our goal is to keep the patients coming so that we can keep adding cars.
I just wondered where in the United States the Dispatch Health actually had its nucleus. Where did it start?
Denver, Colorado.
Okay.
So they have 35 vehicles in Denver.
Right.
So if you go on the map on Dispatch Health website, you can see, so we've had a lot of snowbirds that have utilized us up in other states, northern states, and then have utilized us here.
Right.
So there is a lot of cross. That becomes a little frustrating for us because our technology, all of a sudden the charts in Texas and the charts so it's just a matter of our IT having to merge charts together because they look at, they're 2 separate people instead. But there's been a lot of word of mouth. We've got people that live up north that their parents are down here and say, hey, listen, I just called Dispatch to come to see you.
Right.
So, because they're aware of us.
Right. Interesting. Very good.
Yes.
So other areas, how about the Northeast? I'm thinking New Jersey,
Yeah.
Philadelphia.
Yep. They're opening, Long Island is coming up soon. We have, I think, northern New Jersey. We're not in the central New York yet.
Okay.
So in Ohio, Chicago, everything up there.
And then I want to be sure I heard something in Cindy's presentation. You're working with a number of providers, Medicare, Medicaid, but I thought you said something about you working with Florida Blues, but Florida Blue is not in the system yet? Did I understand that correctly?
It's in system for Lee Health. It's not in system for Dispatch Health. And so they are working on connecting with Florida Blues and contracting with them.
And the more that we're growing, the more that we will get major insurance, but Medicare definitely.
Mm-hmm.
Yes.
So just to clarify, so if you're Medicare and your supplemental is Blue Cross, the Medicare connection.
Yes. Yes. And then they'll be able to tell you when you register on the phone, you know, they can check your insurance and make sure, you know, as far as co-pays and everything else.
Yes.
It's generally no more of a copay than urgent care, than going into an urgent care.
Is that a little bit more limiting and have to be in-network for Medicare Advantage plans as opposed to Medicare supplement plans?
I think that from what I've been told, all Medicare is accepted because they can bill under the Medicare plan. So then, you know, the question would be when you call in the person who, basically it's like you register when you walk into an urgent care and they check your insurance and they verify on the computer. They're going to do the same thing mobily. So making sure that asking them if that the Advantage plan doesn't participate, what would be your financial responsibility? And if it is something that you're comfortable with.
Any other questions? Thank you very much. We appreciate this.
We have bags for anybody that has all of our information, along with some hand sanitizer and ice packs and lots of goodies.
They have plenty of bags, so you'll be able to take maybe even a second one if you need it. Thanks very much. We appreciate it.
Have a nice day,
Well done.
Also
Thank
keep
you.
in mind that you can go back to your residential communities and share this information with them. And these folks are happy to come in when they're not driving around and do the same kind of a presentation to your community, your residential community. So I think it's a good idea. Think about this. And those of you who are watching this recording, think about it as well. You can reach out to them at 239-322-3434. 239-322-3434, and get more information about them and perhaps bring them into your communities and let them talk to the people directly at the kinds of meetings you have. So again, thank you very much, ladies. It's been really a pleasure.
We will leave all these for anybody who would like them. You can take many. If you have other people you need to bring them to.
Okay, so while they're doing that, let me get into my report. And I want to begin with something that you may or may not be aware of. You know, the ECCL has been around for 20 years. The Estero has been around for about 20 years. And over those years, they've made many, many accomplishments, especially in the last 10 years or so, when the movement was to create the village of Estero. Some of you may be aware of all of that. But there was a significant amount of activity going on, and the ECCL did tremendous things to actually establish the village of Estero and fill the council chairs in the mayor's slot. So they really did a tremendous job to make all that happen. But let me be very candid with you. Today is not the same. Things that are going on today are not the same as they were going on back then. And the ECCL has got to respond to current times and issues and come to terms with a lot of things, especially what they're all about and why we exist. So I want to give you an idea of what the executive management team has been working on, and you'll start to hear more and more of this over time. We know, as I said, there's a value to past achievements, but we need to do a self-assessment in the executive management team and come to terms with really a number of things. And I'm going to outline just and explain what they are. First of all, we have to decide why we exist. What's pushing us? Our purpose should articulate why we do what we do and why our organization exists. Right now, we don't have a purpose statement. We have a mission statement that was created again during different times, and we have to go back and come to terms with that. The purpose will drive us, and once we decide very clearly why we exist, then we can move on to creating the mission statement, which is how we're going to achieve what we think we're here to do. The mission drives us. It's how we accomplish our purpose. It drives us in every day to fulfill our purpose. It's a direct path between our purpose and then a vision. So you've got the purpose statement and you've got the vision statement. The purpose and the mission statement. Once that's done and we have that laid out, we now have to put together what our vision is. What do we aspire to? Our vision statement should reflect what we experience and achieve in the future, the results we're reaching for, and the measurable impact we want to make. And that's what leads us to the impact. It's the impact that matters. So all of this process that's going to be going on, this is going to be going on for months, probably into the fall. All of this that's taking place helps us decide what our goals are going to be. What are we going to spend time on? What are we looking for to achieve for the Village of Estero or the greater Estero area? And things could really be as simple as setting goals to figure out how we're going to impact the environment, how we're going to impact healthcare, how we're going to impact safety and education, and healthcare itself, if I didn't say that. So when we figure that out, we will create these goals that will drive us moving towards fulfilling our purpose, making sure that we achieve our mission, and that the vision we put together is real, and we can measure whether we've been effective over time. So I wanted to just lay this out for you. It's really important to understand that the ECCL is going through changes, and the executive management team has reached that conclusion. We must get into this and take a deep dive and understand clearly what we're all about. Because what we're thinking now, it may not be as effective for the future. We've got to think in terms of what does the future look like for the greater Estero area, and how does the ECCL fit in and make the kinds of changes and impact that's going to make it a better place to live, work, and play. So I wanted to share that with you. Let me go into